Acute malnutrition is a set of protocols to classify areas into 5 different phases based on the severity of acute malnutrition, identifying the causes of acute malnutrition, and providing recommendations to address acute malnutrition. We measure the acute malnutrition on children using 2 basic indicators. One is called weight for height, which is based on the weight and the height of the child and a reference child. Secondly, we also measure acute malnutrition using mid-upper arm circumference. So basically you put a tape around the child's left arm and measure the diameter of the mid-upper arm, and then you identify acute malnutrition. Thirdly, you also measure acute malnutrition using edema, whether the child has edema or not, and whether it is nutritional edema or not. Acute malnutrition is caused by 3 main causes. The first one is diet. So whether the child is eating enough quality and quantity of the diet. Secondly, it's about care, whether the child is taken care of in terms of whether when the child is sick, when the child is adequately fed. Thirdly, it's about health, and health in general, water and sanitation and hygiene practices in particular. They all are the 3 main causes of acute malnutrition. So in acute malnutrition analysis, areas are classified based on the severity of acute malnutrition. Basically, we look at the prevalence of acute malnutrition. Higher the prevalence, the higher the phase. So based on the prevalence of acute malnutrition, you classify the areas. Once you classify the areas, then you calculate in each of the areas classified how many children are acutely malnourished based on the number of children who live there, based on the prevalence there, and the incidence correction factor. Acute malnutrition analysis inform 3 main decisions. One, areas are prioritized based on the severity of acute malnutrition for intervention. Secondly, number of children are identified as part of the analysis, so this is feed into how much treatment is needed in each of the areas. Thirdly, but more importantly, drivers are identified so that you can specifically plan programs to address the causes of acute malnutrition so that in the future you reduce the level of acute malnutrition.